the Kennedy Forum, and I'll be moderating today's event. It goes without saying COVID-19 has had a profound impact on America's youth, but even before the pandemic, our kids were struggling. Rates of childhood mental health concerns and suicide have risen steadily since 2010, and by 2018, suicide was the second leading cause of death for ages 10 to 24. No one could have predicted what lied ahead, but now the compounding effect of COVID-induced grief, isolation, uncertainty, and fear on kids' mental health has shaken parents and advocates to the core. We must act now. From April to October 2020, the hospitals across the US saw a 24% increase in the proportion of mental health emergency visits for children ages 5 to 11, and a 31% increase for children ages 12 to 17. Suicide attempts among young girls are up. Completed suicide rates decreased for the nation overall in 2020. They increased for boys ages 10 to 14. And Mental Health America screenings show clear increases in symptoms of moderate to severe anxiety and depression, which, as we all know, if left untreated, can increase one's chances for substance misuse and addiction down the road. Given these startling statistics, it should come as no surprise that the American Academy of Pediatrics and other leading professional associations very recently declared a national emergency in child and adolescent mental health. Our gathering here today, on the heels of such a bold declaration, couldn't be better timed. Now more than ever, there's an urgent need for education systems across the country to address the immediate mental health needs of students head-on. Among other things, this means integrating mental health into curricula and culture and identifying technical support to support more going forward. I'm looking forward to discussing strategies with our panelists today. So let's get started. Catherine Nee serves as advisor to the U.S. Secretary of Education on matters related to the education of children and youth with disabilities, as well as employment and community living for youth and adults with disabilities. Ms. Neese, thank you for being here today.
Happy to be with you. Thank you.
Thank you, Ms. Neese. I am very sorry that the Secretary of Education was unable to be with us, but I appreciate that he was called to the White House, and I am looking forward to rescheduling with him in the near future. We look forward to speaking very soon. We also have Mr. Harry Doc Irvin from Superintendent of San Bernardino City Unified School District, the 7th largest K-12 school district in California, serving 47,000 students and 73 schools in a high-need community where 9 in 10 students qualify for free and reduced lunch. He was previously a teacher, a principal, an assistant superintendent at the Partnerships for LA Schools, superintendent for the Greenfield Union School District in Monterey County, and superintendent of the Bakersfield City School District. Mai C. Lee is the Social Emotional Learning Director for one of the largest school districts in California. She's a 25-year public educator and advocate of educational equity, having previously served as a bilingual paraprofessional, teacher, counselor, and assistant principal. And Mr. Thomas Scarice has been the superintendent of the Westport Public Schools since July 1st, 2020. Previously, he was superintendent of Madison Public Schools, where he led a revisioning process that focused on preparing all learners for the challenges of work and citizenship in the 21st century. Prior to his tenure in Madison, Mr. Scarice served as the assistant superintendent of the Weston Public Schools and as principal of the Interdistrict Two Rivers Magnet Middle School. Before we jump into the discussion today, I'd like to remind the audience that anyone can enter a question for our panelists in the chat box. We will take as many as we can at the end of the session. Now, as I mentioned earlier, the nation's leading pediatric health organizations recently declared a national emergency in youth mental health. They cited the fact that more than 140,000 children have lost a caregiver during the pandemic and reference soaring rates of depression, anxiety, trauma, loneliness, and suicidality among youth. This is tragic on many levels and hits me very hard as a parent, a mental health advocate, and a former educator. We all know there are both short-term and long-term consequences of the pandemic to reckon with. It's going to take strategic, unified approach to turn things around, but the first step is understanding what's happening on the front lines. I'd like to start today's conversation by asking our panelists who are working in local districts to share some of their observations, and I'll start with the two superintendents, Mr. Irvin and Mr. Scarice. What's happening in your communities and districts?
I'd be happy to begin. We're seeing a number of things happen, and the effects are really quite vexing. We're seeing a number of factors conspire. There were previous levels of anxiety and depression even before the pandemic, and that right now has only compounded since the pandemic. We're seeing a number of issues resulting from social and cultural unrest, and I think that the impact on children and teens, particularly from social media, has only compounded over time as well. And our rates of anxiety, depression, and mental health issues has increased significantly, not only among students, but also among the adults that serve our students. So providing the supports there is critically important, given that they're the primary provider for students. Now, the effects, if I look at the effects, I am seeing some positives, that it is forcing a conversation, a real substantive conversation. But more importantly, what I see locally is it's starting to inspire some action. So in a traditional district like mine, a strategic planning process would be looking forward, but maybe not necessarily have a primary pillar around social and emotional wellness. Well, it does now. It probably will be the primary feature when we, finish the actual plan itself. It's making us look at the system itself, capital T, capital S, and question, what are we doing that might actually be perpetuating some of these circumstances, some of these conditions, and what can we do to prevent and respond to those? So it certainly is in the forefront of conversation in our community, and something that I think as a result of the pandemic and a number of other factors has increased over the past couple of years.
Thank you. Dr. Irvin?
Well, thanks, Thomas, and thank you, Amy, and thank you to the Kennedy Forum for giving me this opportunity to highlight this timely issue. And it's a pleasure to join you today. Even before the pandemic, our community faced many challenges that are synonymous with, with large urban school districts nationwide, including high rates of poverty, unemployment, and crime. And COVID, took that to a whole new level because our schools all moved to online learning overnight and stayed that way for nearly 18 months, which meant that students lost one of the places that was traditionally, safest for them to be. They were separated from their friends, social connections, and many supports that our schools offer. So when the pandemic hit, San Bernardino suffered, disproportionately from the loss of family income, not to mention the grief that many in this community and across the country experienced following the death of loved ones from COVID and with COVID. Children in our school district who were already coping with mental health conditions have been especially vulnerable during the pandemic. So when we went to this virtual learning environment, we used technology solutions to move many of our supports online, and giving our students all the help that we could during the campus closures. We did a lot of that. And today, with more than 95% of our students returning to school in person, we see a heightened need for social emotional learning and mental health supports. Our students are struggling with our students are struggling a little bit as they reacclimate to the social norms of our campuses, having missed out on a whole year of school experiences. Now think about this for a moment. Think about this. We welcome a whole cohort of 10th grade students who did not have a freshman year on a high school campus. Instead, they were isolated, in some cases, not in the best of home environments. And so we must all do whatever it takes to help our students return to a new sense of normalcy. And that is a challenge today, because everyone who needs to be at their best to support our children in our schools are struggling as well. Everyone, our teachers, support staff, our parents, they are stressed and exhausted. And I think that, we need to know that they need help as well. And so, thank you again to all of you for jumpstarting this national dialogue about the importance of this topic. And there's never been a better time for us than now to be talking about this issue. Thank you.
Well, you're right about parents being exhausted. I think we're seeing a lot of that. Thank you. Ms. Lee, you direct social emotional learning in Sacramento schools. From your vantage point, what challenges have you faced since everyone's returned to the classrooms?
So I almost just want to say ditto and ditto because Thomas and Doc said exactly what I think we are seeing. And this work is very near and dear to my heart as the director of social emotional learning for my district. And so we see and we work very closely with our teachers and our school sites and our parents and our students. So amongst our young people, we are seeing a variety of challenges that I think have already been highlighted, but I'll just add on to what they shared. I think one of the things that our students are having to navigate are those health and safety mitigations and the pervasive concern of this pandemic that is still ongoing. So there's a lot of stress and anxiety that comes with that. In fact, I was talking to a high school student the other day who said, one of the hardest things for me is the masking, because I learn better when I can see facial expressions from my teachers and my peers, and that's been a huge, huge struggle. So something as mundane as masking is a huge issue for some students. I would say another issue is around, and I think, Doc, you might have said this, our students who are ninth graders really are functioning at the social and emotional level of, say, a seventh grader, because that's the last time they were in physical space with their peers and with their teachers. And so we are seeing a lot of students who are struggling with those basic social skills and learning how to be in community and to be in positive peer relationships. So we're seeing a lot of behavior as a result of that. Other challenges are around, and I think Thomas brought this up, specific to some of our students around issues related to social political issues and the bombardment and nonstop news cycle, especially as kids are more savvy and more connected through social media mediums. So for example, last spring, we surveyed our students, and our Asian American students were very worried and very stressed about having to return to in-person because of the recent uptick in anti-Asian violence and attacks. And then lastly, I would say, I concur that our adults are also struggling. We are understaffed, we are under-resourced, and folks are overwhelmed and overworked and overstretched. And so I would say that there's a lot of dysregulated adults trying to attend to dysregulated students and families, and it's going to have the unintended consequences of hurting our most vulnerable student groups. So I would say that the mental health across the board is in a state of crisis, and so that is an issue that we are seeing, and it's the biggest challenge, I think, before we can even begin to attend to the academic needs.
Well, this is exactly why we need to be having this conversation. Thank you for those comments. And as we think about addressing this, we know that the American Rescue Plan Act contained nearly $130 billion in resources to reopen schools and address the effects of the pandemic. Schools can use these funds for mental health and social emotional learning. However, many simply don't know where to begin. To help, the Department of Education recently released a 100+ page guide. Ms. Neese, can you give us an overview of this new resource?
I'm very happy to do so. And again, thank you again for having me. And as was mentioned at the top, Secretary Cardona unfortunately can't be with us today because of a White House meeting, but I'm certainly very excited to be here, and he looks forward to engaging with this group in the near future. So please know he wishes he could be here if it was up to him. So
Well,
I
Ms.
want to.
Neese, I just have to interrupt and say, my husband always said, even though he was the one up front, it was the staff who was doing all of the work. So we're really glad you're here because we know you understand all of the nuts and bolts of this guide. So thank you.
Yeah. Absolutely. And thank you for recognizing this comprehensive guide that the department just released. It's entitled Supporting Child and Student Social, Emotional, Behavioral, and Mental Health Needs. And it's really designed to provide information and resources to enhance the mental health needs of both children, students, and the adults involved. The resource highlights 7 key challenges and also provides 7 recommendations to address those challenges. It also includes real world examples of how to implement best practice so that it isn't just an esoteric exercise, but there are very concrete, pragmatic steps that schools and districts can take. So the 7 challenges are this: rising mental health needs and the disparities among children and student groups. You've heard about that already today. A perceived stigma is a barrier to access. That's been true for as long as all of us have been around. Ineffective implementation of practices, fragmented delivery systems, policy and funding gaps, gaps in professional development and support, and a lack of access to usable data to guide implementation decisions. So recognizing those 7 challenges, the resource has the following 7 recommendations. And the first is to prioritize wellness for each and every child, student, educator, and provider. And I always think it's the old airplane, the rule of put your mask on first before you help your child. If we don't ensure that educators have the supports and have the mental health supports that they need, they're not going to be able to deliver the kind of care to these kids that they would want to. We also want to enhance mental health literacy, reduce the stigma and other barriers to access. This has been a tough 18 months for lots of people. We have to accept people where they are and give them the supports that they need to get to a place of stability and health. The third is to implement a continuum of evidence-based prevention practices. We know what works. We just have to do it. And we need to not give educators the notion that they need to reinvent the wheel over and over and over again. We have the evidence. We need to get it in their hands. Fourth, we need to establish an integrated framework of educational, social, emotional, and behavioral health supports for everybody. 5, leverage policy and funding. 6, enhance workforce capacity. And lastly, use data for decision-making to promote equitable implementation and outcomes. That's really the whole point of the guide, is to give those evidence practices, put them in the hands of people who can do something. And with the Rescue Act funds, that they have some resources to actually make it happen. So we are hoping that this is a tool that districts and states can really rely on as we dig out from the emotional hole that I think so many people are in right now.
Staying with you for just a moment, what are some of the basic foundational elements that all schools in America should have in place to support students' mental health? What are some things that should be happening right now?
Sure. Well, I think first is an honest recognition that the psychological well-being of students is as important as their academic support, as their academic achievement. And you if you are depressed or suicidal, it doesn't take a rocket science to understand that's going to affect your success in school. We know that students that have a high level of psychological stress are less academically successful. They have more test anxiety, lower academic self-sufficiency, and less effective time management and the use of study resources. As you mentioned, the Biden administration has invested a significant amount of money, billions of dollars to states to help them address that. And I think very simply, we hope the districts can use these funds to hire school psychologists, counselors, social workers, nurses, and other health professionals, as well as to provide training and supports for the general education staff, the special education staff, the bus drivers, the nutrition folks that serve lunch. Everyone has to be attuned to what are those things that we can, as the adults involved, what can we do to support children to feel safe in a stable place with all the uncertainty in the world, but that school and all the adults in the building are there to support them to be successful. So I think that's one of the most important things that we can hope can happen right now.
I think that's so important that you highlight all of the people that are coming in contact with our youth, because I know just firsthand from going and picking up my own kids at school, it's the person that's helping them cross the street safely that seems to get that smile and, you know, really build some kind of relationship with kids because they have a little time to talk, and it's not always who you expect in the classroom.
Exactly.
I know that there are a lot of acronyms used when it comes to student mental health, including SEL, MTSS. Mr. Scarice, can you elaborate on what these programs entail and why they're so important to overall well-being?
Yeah, we love acronyms in education. You have to be bilingual. That's the prerequisite to becoming an educator. You have to understand all the acronyms. So, yeah, interestingly enough, Amy, the multi-tiered system of supports, I first stumbled across the concept of it over 15 years ago when the Individuals with Disabilities Act was renewed around 2005 or so. And there was a rethinking of how we would identify students, and it was less of an emphasis on are we going to just test kids and say yes or no they're disabled, and moving more towards an equitable system where you're looking at responses to interventions. So the acronym RTI kind of took hold there. But what that is essentially the tiered system where interventions ramp up in response to student needs. Now, traditionally, we think of academics. But over the past period of years now, the social emotional side has definitely taken center stage for a lot of kids in responses to interventions. The best analogy to understand it really is if you look at like the public health prevention model, where you have your primary and universal interventions and strategies and preventive measures in place for everybody, and then your secondary and your for the more acute, your tertiary type of interventions. Even just look at your dental, your dental oral hygiene. You have a dentist, you brush your teeth, you floss, and then maybe you need a procedure, and then maybe you need even a more severe procedure. So it kind of tailors to the individual student, and that's the way the multi-tiered system of supports works. Traditionally, again, it was more focused on academics. However, it's really starting to orient itself now in a balance with the social and emotional side, the psychological side, the mental health side. So that's where SEL comes into play. SEL is really not new. As a child of the 70s, I'm a proud, recipient of an incredible developmental education in the 70s. It was a big focus. Mr. Rogers had a huge impact on really good work back then. And we moved away from it for a few decades there because we hyper-focused on performance in reading and math, so we had this awful tyranny of or in education where we can embrace an and I think the SEL piece is being forced for some of the more unfortunate reasons we've talked about, but it's really just the process by which kids, adults, we acquire those attitudes, the knowledge, the skills to develop healthy identities, to manage emotions, to achieve goals, personal or collective, to show empathy for others and to maintain relationships, make sure we make good decisions. That's what SEL really is at its core. It's about the development of self-awareness, self-management, relationship skills. But I think something that's lost in the discussion around SEL more often than not is it's inextricably linked to academic development. You cannot separate the two. You need to have the two go together hand in hand. It's the humane thing to do, number one. But if our purpose is teaching and learning in schools, you can't divorce those two concepts. And I think, as a superintendent who has been a superintendent for 10 years, been an educator for 26 years, I see us coming off about 2 decades of a hyper focus on improving reading and math scores at a cost. And many of us became the educational Enron. We push for those scores and put everything else aside. Then I'm not denying that academic achievement is a primary focus of schools. When you couple those 2 decades with a pandemic, and then you tie in the Generation Z, or whatever they're called now, our current generation, who, in my opinion, has been exposed to more violent and sexual images than any generation before them, and access to technology that no generation before saw. I don't know how we couldn't make SEL our #1 priority. And it nests so well in a multi-tiered system of supports. We have a pretty good spectrum right now, but I think the acute cases in my district, we have had the opportunity to partner with some providers because we're providing services in schools now we were never asked to. These are services that we typically would outplace students for, but these are our kids, and these are our kids that are showing up. And the way we thought of providing services for kids in a tiered system, the tippity top of the pyramid a generation ago, we would have sent kids to a different school. And now we're providing them inside our schools. So outside vendors, we work with Effective School Solutions out of New Jersey. They help us with our most acute cases, and they're keeping kids with us in partnership in their home school. So it has changed quite a bit. SEL and MTSS go hand in hand.
Yeah, sounds like you've built that out, and I couldn't agree more with that being so foundational. Mr. Irvin, utilizing the multi-tiered system of support framework, which components of social, emotional, physical wellness can be addressed by school districts and their staff, and which can be addressed by community partners, like we just heard.
Yeah, and first of all, ditto to both the Assistant Secretary Neese and Thomas for their statements and comments, and also Thomas for aging us, going back to the 70s, Thomas, starting right there. So thank you for that. But let me start by saying that the social, emotional, and physical well-being of young people is everybody's business. And Thomas, you're right, it's everybody's business. Parents, educators, community leaders, the private sectors. We all have to work together to broaden the availability, of health, mental health, and other supports for children who need them the most. We are fortunate that San Bernardino Center Unified has a long-standing record of engaging, partners to support our schools and our scholars. We have layered these partnerships with our own district supports in order to support each student based on their individual needs. Now, while most students can be served well by a system that is designed for everyone, others need more individualized interventions. And so for example, as we prepared to welcome our 95% of our students back to in-person learning this year, we recognized that social emotional learning would be critical. And at the first tier, as we know, SEL starts with our classroom teachers. So the first thing that we did as a teacher was equip every teacher in our district with 2 full days of training and several weeks of specific lessons and activities to help them support students, social emotional needs. Now at this level, they're really building relationships with students in the classrooms using, restorative practices like check-ins and community circles. Teachers are helping our students develop coping skills in a trauma-responsive way with brain breaks and mindfulness practices, for example. We also rely on our partners to help us with Tier 1 supports as well. For example, all of our students have access to telemedicine services through Hazel Health to address immediate medical needs on campus or at home, which helps our students stay in school. At the Tier 2 level, internally, our counselors engage small groups in lessons around social emotional coping strategies to address anxiety and depression. These are the things that are happening out there. And our partners like Loma Linda University, they help us to provide outreach to targeted groups of chronically absent students through a jointly, developed program that really provides extra school-related training to our community health workers, because we have those within our districts as well. And finally, I'll say that at the tier 3 level, our in-house therapists provide mental health therapy, and our partners, we also partner with Inland Empire Health Plan, provides like case management for physical health, mental health, and just really the basic needs, of our families or for our families. So, I guess the moral to the story here is that schools can't do it all, and they can't do all this by themselves, right? We all know we cannot do this by ourselves, right? We need help. So partners like Hazel Health and Loma Linda University, they can really help districts such as our district and other districts respond to the individual needs, of the whole child. So that was a lot, but very important information.
No, I think that is really important. I know as a former classroom teacher, feeling like there was some other people with expertise that I could engage really crucial. And we know we're asking a lot of the school staff right now as it is. They're all dealing with their own things. So these partnerships will be so key. Ms. Lee, turning to you, there have been now decades of research pointing to the detrimental impact of adverse childhood experiences, or ACEs. Yet as a nation, we still don't do a great job of screening for trauma and identifying children who need help. However, there was recently some good news for your home state of California. More than 20,500 California clinicians have now been trained to screen for ACEs, and more than 500,000 children and adults across the state have already been screened. This is great progress. What steps can school districts take to ensure they're using trauma-informed practices and strategies to help students?
Thank you for that question. So I think for educators in districts, it's really important to not only understand the impact of trauma on learning and understanding ACEs, but also to know how to attend to students' needs with trauma-informed practices that can mitigate further harm and improve better academic outcomes, health outcomes. So it's about teaching our adults to learn how to say what has happened and how can I help, versus why are you doing that or stop doing that. So I think those simple ways can support to mitigate the further harm. I would say in terms of practical steps that school districts can take, first it would be start with having clear board policies on whole child education with very specific language inclusive of social emotional learning, as well as trauma-informed and healing center practices. And I'm including the language of healing center practices because I do want us to move away from the deficit language that our students are their trauma. Our students are not their trauma. And so we need to be moving towards this notion of healing and an asset-based framing around the trauma that we experience and the value of the resilience that we have to move beyond that. And frankly, the malleability of the brain, we've learned so much about brain science there. Another step would be to invest in ongoing professional development of all educators. And I'm not just talking about leaders and teachers, but inclusive of all support staff, your office managers, your hall monitors, because we are all in the building with all of our students. So from the boardroom all the way to the classroom. Another practical step is to partner with organizations that help to translate science into practice. So an organization in California that we work with is Turnaround for Children, and they have been really instrumental in helping our educators to understand what the science says and how they can then transfer that into practical instructional pedagogy in the classroom. Another step is the fidelity of implementation. I think I heard a lot about SEL and relationship building and community building as part of that tier 1 in that MTSS framework, that in terms of fidelity, that all schools, all students, all teachers, wall to wall, have access to what we call the 3 R's. So daily routines that are safe, predictable and welcoming for all students, relationship-centered classrooms that are affirming and positive, and certainly the explicit development of SEL skills in order to nurture students' sense of resilience and arm them with the tools that they will need to navigate challenges and crises. And lastly, really this investment in resources across the full gamut of supports. So in addition to that tier 1 fidelity of implementation and processes and practices, investing in tier 2 and 3 student support services such as mental health specialists, clinicians, social workers who can provide those in-house supports without parents and families having to navigate outside organizations. So having all of that within sort of an integrated model or approach to ensure that our students, whether it's 8 o'clock in the morning or 2 o'clock in the afternoon, that they have direct access to adults who are caring and also have the skill sets to support those needs.
Fantastic. I am going to transition now to what it's going to take to address our youth mental health crisis long term, which we know this is all part of it. But Mr. Irvin, how can school districts approach wellness in a systematic way to support social, emotional, and physical health needs during a global pandemic, but also beyond? What are the long-term returns on these investments?
Oh, Amy, I'm glad we're talking about the long-term impact on students because we see this as an ongoing complex need that we can't address in one school year, especially because we're still in the midst of this pandemic. And now is the time to be innovative and create a new legacy, right, for public education. Our schools and personnel must know every student by name and need. Our parents, really need to have someone they feel comfortable with so that they will be vulnerable and ask for the help when their children need it. Schools, think about this, schools that look at the needs of the whole child are the schools that we believe will be the most success in the future. They'll have the most success. So research has shown that the impact of social emotional learning runs very deep. And so therefore, in the school environment, we will see the benefits. We'll see benefits like increased academic achievement, positive social interactions, and higher graduation rates. And students will continue using these important life skills well after they learn a high school diploma, because we know that conflict resolution, teamwork, and communication are things that we use daily, even as adults. I think that, if we seriously invest in supporting mental health and social emotional learning of young people in schools now, we will see a whole host of downstream benefits as a society, including things such as healthier relationships in our homes, lower incarceration rates, and personal success in a career. Because as adults, they will have developed higher levels of emotional intelligence, which we know research links to positive outcomes like these. So these are some of my thoughts.
Yeah. And Ms. Lee, for schools that are just beginning the process of integrating social emotional learning, mental health literacy, trauma-informed care into their curriculum and their culture, can you share some best practices you've learned over the years? How might early processes evolve?
So thank you. So I would underscore what I think Thomas said earlier, is that this is not new, right? We've done this before. I think part of what we're understanding now is how do we do this with greater intentionality and priority, and with explicit intent to support our students. So I would say for school districts that are just starting to try to figure this out, start with where you are, assess where you are already doing the work, and build from there. I don't know that We need to start from scratch. I think folks are doing really wonderful work, whether you call it SEL or climate culture or restorative justice or what have you. I would imagine most districts are doing some really great work. So start there. I would also say that one of the lessons learned earlier on is that we need to connect SEL to our equity imperative in terms of what we're trying to do across the system. And so that messaging and that definition needs to be linked to the equity work that we're embarking on as well. Also, social emotional learning starts with adults. I think we've talked about that in many different ways here. But adults who are continuously reflective, restorative, and equity minded, that's the heavy work that needs to get started underway. So there's investment that districts will need to prioritize so that their adults are prepared. And I'm not just talking about self-care, right? Because self-care is one thing. I think there's also how do we leverage the equity-minded, the heart space and the head space in order to get adults who are showing up in the very best way to really build on the promise of equity, access, and social justice for all students across all systems. Another piece, and I think this has also been said, but I want to amplify it here as well, is really positioning social emotional learning as that universal driver with your MTSS framework. Social emotional learning has to be the foundation on which teaching and learning occurs, and the universal approach to cultivating positive conditions that affirm our students' sense of identity, cultivate their sense of belonging, and really nurturing agency so that our students feel empowered to be the independent learners that they can be and to thrive. Another recommendation that I would have schools think about is social emotional learning is both explicit skills development and intentionally maximizing positive learning conditions. So it's not just adopting a second step curriculum, doing a lesson on 9 o'clock Monday morning. It's the whole DNA of how a learning environment is structured. So establishing those welcoming inclusion routines and rituals at the beginning of the day, engaging strategies that are priming and cultivating those SEL skills during academic content, so really integrated into academic content. And then closing each day with what we call optimistic closures that help students to make meaning of the learning that's taken place so that they feel like their time, 6 hours, 7 hours a day, has meaning and there's a sense of interest that we're engaging. But really what it comes down to is how are we also deepening those connections, those relationships, those peer-to-peer students to adult. And as a collective, how do we support students to build that sense of collective efficacy, to want to come to school, to want to engage, to want to show up with the very best version of who they are. And then the last thing in terms of SEL implementation is the constant communication and messaging and integration across the district. SEL is not something that teachers do. It's not something that students do or that we do to students. It's something, I think I've used this term before, from the boardroom to the classroom, that we are weaving and threading throughout everything that we do, including our business services office. And I'm going to pull that up because I think that, sometimes we forget that we are in the business of people and supporting people. And so if I'm looking at a spreadsheet, I need to also understand that paying people on time, that spreadsheet has human bodies attached to it. And so, again, that constant calibration that this work has to be, and I'm going to use this term again, the DNA for how our organizations function and care for each other.
I am just so grateful for all of you and your work, and that, this is the direction that we're moving in. This is what I think we all deserve and need to be able to make it through this really challenging time. But I know that Mr. Scarice Are we seeing a light at the end of the tunnel with the vast majority of school-age children now eligible for vaccinations? I know there's certainly hope that we can return to some sense of normalcy in the near future, but I'm wondering if we collectively need to define a new normal for mental health as we navigate this next phase of life. What would this look like?
Yeah, I was just talking about this with a number of colleagues and administrators in my district, that many professions returned and embraced a new normal. They were disrupted and changed in a rather permanent way, where I can speak for my district. We craved normalcy as we recall it and as we knew it so much. We couldn't wait to dive back into what we used to do, because that's what normal was. And it was a false start. It's not what normal is right now. So before the pandemic, we did experience an increased rate of anxiety, depression cases. The pandemic only accelerated the mental health issues that we had: the isolation, the uncertainty, losing loved ones, economic hardship. This all just increased what we were dealing with at a level that became a bit overwhelming. A new normal for me would have a few components. It would certainly include a priority. It would be systemic. It would be for all. So what do I mean by that? By being a priority, a new normal, making SEL a priority for our work. The why part of it is critical. Number one, it's humane. It is the right thing to do for kids. We know child development hasn't changed that much. You can set your watch to it. Anyone who's raised a child knows that a typical child will hit certain stages at certain times and have certain needs at different times. It broke my heart when my daughter, who's now 17, started to peel away from me as a teenager, but I could have set my watch to it, right? I mean, it's right on schedule, but it is the right thing to do, is to match our practices to social and emotional development, to where kids are, but also their basic needs. It doesn't matter the demographics. It doesn't matter the kids you serve. Every child has a sense of belonging that has to be met. It could be in Doc's district. It could be in my district. We have very different demographics, but we serve kids. And it's always noble work when you're serving kids. All kids have a sense of belonging. They all have a sense of needing connections and relationships. And every child wants to feel significant. It's a humane thing to do. That's why it should be a priority. But it's also practical. This is very practical work, in a sense that if you take a look and project out what any futurist will say are the capacities and skills needed in the global economy, it's going to be all the things we're talking about today. It's going to be humility. It's going to be leadership. It's going to be empathy, communication, being able to self-regulate, being able to make good, responsible decisions. Those are the things that are going to matter in a practical sense. And it really, SEL just provides a prerequisite for all the supports for the things that we do in school: academic, civic, career, whole child. So the priority piece to me is that call to action is clear, but the new normal has to be systemic. And I think Mike did a nice job pointing to this. And I'll footnote you, but I'm going to use your DNA piece there. I love that, because it can't be an add-on. We can't make SEL be the one more thing. My teachers aren't at a tipping point. They're tipped over. Okay, let's be honest. As a profession, we've tipped over. And right now, to have an add-on is not going to, it's actually not even going to do anything positively for adults or kids. You have to weave it in the fabric of the day. And there are ways to do it when we're teaching actual academic content. If we're studying self-awareness, okay, in an SEL program, it so naturally lends itself to, in language arts, when you're doing a character study in a book, to look at how, to shed a light on how that character developed self-awareness and overcame a challenge. If you're studying, say, responsible decision-making in your SEL program, you can look in history, and in your history courses, there are stories of decisions that were, inflection points, and how ethical decisions pointed one way or another. So we can weave this in. I think of, we're silo-based largely. We have to really kick that down. And I think of Churchill's quote around behavior never lies. And I won't do justice to the whole quote, but it ends with behavior never lies. And our actions have to be consistent with our words. If we're going to focus on self-awareness and growth mindset, we have to have practices that align to that. We can't say to kids, smart is something you get, But at 9 years old, we're going to determine what math track you're on for the next 8 years. It's very inconsistent. So we have to rethink the system. And for MI to bring it as far to the business offices, I think that's brilliant. We have to look at our work very holistically. And the third thing I would say is it's for all. And this has come up time and again. I won't belabor it. Students and the adults. This is for everyone. This is not something we do to kids. It is a cultural mindset of how we run schools.
Couldn't agree more. I know, separate from this focused on school mental health, we're also through Kennedy Forum and One Mind talking all the time about workplace mental health. And as you mentioned, we're trying to prepare this generation for the workforce and for, their life as adults. And CEOs have gotten together now. There's a CEO huddle working on how they can improve workplace mental health because they're seeing this impacting productivity, and corporations are thinking about this. So I really believe that this is the future and where we need to be headed. And we've discussed a lot around this today, Mr. Irvin. Let's talk about the role of data in charting a new path forward, because we know that measuring students' mental health and well-being can be critical to helping schools identify trends and address specific issues head on. Do you have any recommendations for data? How have we collect data, and what process program changed over time? What might they look like going forward?
Well, first of all, I want to say that thanks a lot for using that DNA and SEL all in the same sentence. And Thomas, tell us how you really feel. You're on the roll there, Thomas, and I tell you, taking it to a whole nother level. And let's talk about data. I think as educators, data is one of the most powerful tools that we use in education to inform, engage, and create opportunities for students, right? And everyone who supports students should have the right data in the right format at the right time to make decisions that are in the best interest of kids. And that's a lot there, right? Should have the right data in the right format at the right time to make decisions that are in the best interest of children. And we should all remember that the data is just where we are, but not who we are, right? Think about that for a minute. The data is just where we are, but not who we are. And in monitoring it to gauge the impact of our action can also help us all get better. For example, student attendance is a data point that educators, we often focus on it because it's a good indicator of academic achievement. And it is also how like most of us in education are funded, right? We're funded from that formula. It is easy for everyone to understand that when students are not in school, they miss out. They're not there. Attendance, however, can also be a powerful indicator of the strength of relationships we develop with our students and how they feel at school. And Thomas hit on that a little bit, because remember, chronic absenteeism may have roots in a student's lack of connection or sense of belonging. And Thomas, you're right, that can happen at any school. It goes back to connection and a sense of belonging. So, in addition to attendance, as a district, we monitor a student's sense of safety, sense of fairness, and a sense of belonging with an annual school and climate and culture survey every year. These data points, we use them, and it really helps us to implement changes with the goal of improving the students' experience in our schools. So when you think about it, social emotional learning has played a big role in helping us to improve these measures. And bottom line is data is so much more than numbers and figures that we use to meet state mandates. We believe, and I'll say that we believe, even as a district, we believe that with training and the right tools, we can use data to create a culture of support and make systemic improvement that benefits all students. And I agree with you, Thomas, it's for all students. And for that to happen, though, data must be transformed from a tool of compliance, right, to one that empowers people and programs for continuous improvement. So those are some of my thoughts on that.
Fantastic. We know that when things are evidence-based, when we have the data, that then we can hopefully get the support to continue doing those things. And that leads us to the next big question is, how do we pay for this? How do we pay for this work? That's what's on so many people's minds. We know that there are a couple barriers, one being, the technical support, the guidance, which we appreciate that we've just received, that we're talking about today. But then the other piece is, how do we sustain this? And we've discussed a lot of the to-dos around program structure and implementation, and now funding. We know it'll be critical for things like expanding telehealth, school-based partnerships, workforce capacity. Ms. Neese, can you tell us more about how significant funding provided to states and districts can be utilized to address the full impact of COVID-19 on students' mental health?
Yeah, absolutely. And it's a tough question. And I'll be honest, at the federal government level, during the course of the pandemic, there have been significant resources that have gone to states to help them address pandemic related needs. And yet right now, in too many communities, we are seeing very dramatic personnel shortages that in some communities are at a crisis level. In my school district in Maryland, they're closing school the day before Thanksgiving because they don't have enough substitute teachers to hold class. In Colorado, to be a substitute teacher, the baseline credential you need is a high school diploma. We can't achieve all the things that we have talked about today if we don't have the people to do it. And we've got overburdened teachers, overburdened special ed teachers, overburdened school counselors and social workers. And we've just got to recognize that our education system, in all the ways that it is funded, and it's predominantly funded at the state level, that we have to have the resources to do right by our kids. And we can't keep asking the adults who chose this vocation for all the right reasons to keep doing things the way they've been doing. I think what you see on this panel, and I don't mean to be paternalistic, but some really incredibly powerful, dedicated people who want kids and schools to work right for everybody. But they've got to have a team behind them, the people to actually do the work. And we as a country have to own that. We just have to. Now, I think we've learned some things from the pandemic, that not everything has to be done in person. And some things can be done through telehealth that can save time and energy and resource. And we shouldn't lose that. Similarly, partnerships, and Doc mentioned this earlier, are absolutely essential. We shouldn't assume that schools and the building principal or the district leader by themselves should do everything. The community needs to come together, whether it's mental health supports or after school programs where kids can get more exercise, or some other thing where we can create a sense of belonging, because that's one of the most important things. And then we have to really look at our education system of, are we able to retain these highly qualified folks? Or are they just getting so frustrated that they just see no option but to leave? And we just can't continue to treat our educators without the highest level of respect that they are due, and think we're going to have really good outcomes for kids. Now, as Debbie Downer there, I do have to say one thing, a couple things positive. First of all, I think there are a lot of really dedicated people who can do a lot with a little. And I think that's what educators have done since the beginning of time, right? That's what they've tried to do. But I was thinking about this a couple weeks ago. More than 4 decades ago, when I was in high school, one of my best friends committed suicide, and there were no supports. I mean, none. Zippo. We just went to school the next day. Nobody talked about it. Nobody said, "Are you okay?" Nobody said, "Don't beat yourself up if you're not going to be focused in class today." And where we were then and where we are today are light years ahead. And so I think we need to acknowledge how much we have learned, what kind of systems are in place and can be strengthened, and that we have dedicated people who want to see things right for kids and want to have the right kind of expectations for all kids and the supports to the educators so that that can be implemented with fidelity.
Well, you know, this has been a really powerful conversation, and I want to make sure that we are mindful of the time. We have some questions in the chat. I want to, just before we wrap and move to that, I wanted to ask one more on where we're at right now when it comes to talking about equity and advancing equity. We know that our effects of COVID-19 have disproportionately been borne by Black, Indigenous, other people of color. It's also disproportionately affected children with disabilities. So while we can and must take broad action to end systematic racism and reduce disparities across society, Ms. Neese, what specific role can schools and our broader education system play?
Thank you for that question. And I think it's one of the most important that we've talked about today. I think about what many of the panelists have talked about. There are school-wide initiatives, there are district-wide initiatives, and there are statewide initiatives, and they all have a lot of value, but they have to all be grounded in high expectations of children and of the educators involved. President George W. Bush used to talk about the tyranny of low expectations when applied to students with disabilities. And that was certainly, as he was talking about, wanting to have every student's academic progress be measured and reported. And I think there's a lot of value to academic progress be measured and reported. And at the same time, that's not the total picture, right? We need to have kids be okay, and we need them to have the skills to get along with each other, to be able to be active members of their communities. The other thing is we need to grow a pipeline of educators who look like the kids that they serve. And we at the department have a reinvigorated priority on equity and trying to make sure that there are more educators of color, more educators who are English, whose first language isn't English, more educators who are adults with disabilities. So children can see success in their classrooms of people who look just like them. And I think, working with states to help them build their own pipeline, I suspect both of our superintendents have done that because out of necessity, growing your own and having people from those communities stay in their communities, I think is one of the most powerful tools we have as people who want public education to be successful for all kids. Schools are the hub of our communities. They are where we make a lot of decisions that affect the rest of our lives. And so having access to a cadre of people who are invested in that community are going to be absolutely essential going forward.
Absolutely. Mr. Irvin, school-based services help to reduce barriers around transportation and health insurance that disproportionately affect youth of color. Since we know that youth of color are more likely than white youth to receive mental health services in educational settings, increasing access to that care is most definitely a form of advancing equity. Can you talk about the importance of acknowledging and prioritizing this?
So, I think it's important to start by acknowledging that mental health stressors, do not discriminate, right? But they are more likely to occur in communities like ours with lower socioeconomic status. And so students of color are more, than twice as likely to live in poverty than their white peers, and therefore more than likely to face trauma and encounter barriers in accessing mental health services. So, while they may not be able to get to a mental health provider or medical clinic, in most cases, they do make it to school every day because as a society, we have prioritized education. Now, remember, We put schools in the middle of their neighborhoods and we provide transportation. Now, schools really can help overcome the barriers faced by students of colors, especially faced by students of colors in terms of accessing healthcare, and it is in our best interest to do so. Think about that, because remember, we are in the business of helping children, all children, something Thomas and my colleagues talked about earlier, and our job is to help them to succeed, and best, especially when students are struggling with physical and mental health concerns. Because remember, if students have physical or mental health concerns, they cannot focus on learning. Now, one good thing that has come out of this pandemic is that we've helped a lot of underprivileged families bridge the digital divide. Technology provided by schools also gives students access to telemedicine solutions that were not really available a year ago. If you think about a year ago, they were not available. So, I think in closing, thinking about this new environment, if we think creatively and we look for a solution that helps students, I think, schools can serve as wellness hubs in a community where these services are integrated. Removing barriers and allowing students and families to get the help they need that they would not otherwise be afforded. So I know in the interest of time, I'll cut it short there, but I think it's very important. Thank you.
Thank you so much. I love that. I know we're supporting that. Inseparable, who has the Hopeful Futures campaign, is talking a lot about that community model. And so now let's take a minute and look at some of the questions that our viewers have posed. We've got a lot of engaging questions, and I think that'll tie in some of the topics that we were hoping to get to in our main portion. So just to go back to our chat, and if you do have some questions that you'd like to post in the chat, please feel free to do that. And we will go back. Maybe I could start back with you, Ms. Lee. When we talk about building out different institutions or environments that can invite social well-being, Sheila asked, do you think that building out a different institutional environment can invite social well-being to be developed differently or better?
So can I ask for a clarification? When we say
if we
are we talking about classroom environments? Are we talking about climate and culture across schools?
Different institutional environment can invite social well-being to be developed differently or better. Maybe Sheila, if you are still on and you want to add to that, you can give us a little bit more context, and then we could come back to it. Roseanne says, I worked in a school-based health center. So this goes back to Doc, as you were talking about, a school-based health center in an elementary school in Connecticut. We have all lost 80% of our ability to learn new information. So the students are happy to see friends, but overwhelmed by the academics. Are there school-based health centers in the participants' schools? So maybe each of you could just tell us a little bit about whether or not you have a school-based health center and it's working in your school.
Yeah, we have one. We have one a wellness center at one of our schools, and in my previous district we had 4, but they were not in the school system. So one of the things that we're thinking as we go forward in this new environment, our goal is to really build regional wellness centers, but stationed right on our high school campuses, and that is one of the goals that we're thinking about going forward, because we think if we can build a wellness center right on our high school campuses, and they're regionally located, all of our students and teachers and members of our staff will have access to that. And that'll allow our students to stay in school and continue to learn. But most importantly, it'll allow them to get the services that they need in order to be successful. So in our case, we do have one, but our goal is, as we move forward in this new learning environment, this new normalcy, we're looking to have regional centers, wellness centers located throughout the entire school district. So, but again, the goal is they'll allow us to keep students in school and provide them with the mental health supports that they need. but also our staff, right? Our staff will also have access to those as well, those resources. And remember this, we have Hazel Health that works with us. So that's going to even make it easier for us to transition because we already have that telemedicine system in place. So bottom line is when we put those regional wellness centers at our campuses, we already have this partner. So we're looking forward to it.
Fantastic. Tom?
We do not have those types of service centers, but what we do is rather than wait for the establishment of those, we collaborate and partner with as many in the community as we can. So reaching out proactively for those active partnerships, so the services are incredibly responsive. You know, that's we've had unfortunate circumstances where you leave on a Friday, you come back on a Monday, and a student unfortunately was hospitalized for suicidal ideations or an attempt. And if we don't have those partnerships in place and firmed up, we're left spinning our wheels for a few days or longer. So having an active partnership where you can tap right in, we do have access to mobile crisis, and we do have services for our most acute cases that we do provide in our buildings.
Here's a question for you, Ms. Lee. It's such a politically charged environment, and wondering if, you know, SEL in your experience has come under unfounded political attacks. We talked about kind of all the evidence supporting that, but for such an important and foundational policy, what do you think is the best way to explain and advocate for it, and kind of be able to tread those waters?
Yeah, and I think we've said that in many different ways today in terms of SEL being foundational to accessing core academics. And I think one of the ways that we have found that has been effective is aligning the skills and the strategies that our students will need to access high quality academic tasks that are going to get at achieving those standards. Specifically, sorry, the principal just walked in. So there's a little bit of background noise. I apologize. I'm at a high school for those folks who may not know, supporting the high school today. So aligning that with academic content, aligning that to the Common Core state standards in terms of the skills that are going to be needed. So I think that's really important. I think the other piece that we have to really think about how we position social emotional learning is the climate and culture in which we want to cultivate. So I think I spoke a little bit about both skills and conditions. I think in general, we know that one of the tenets of providing safe spaces to learn is that we're really nurturing positive climates that are inclusive of all students in their learning styles. And for adults as well, I should say, but really, how do we create those rhythms and those rituals that are going to invite our students to be in space with us and to connect? How do we create collaborative structures that students can learn how to engage in constructive dialogue with each other? How do we support students to problem solve? How do we support students to express a sense of empathy and perspective taking? So all of these are life skills that empowers our students to, again, show up with the best versions of themselves. And I can't imagine that any parent that you would ask, what is it that you would want your students to experience when they walk into a classroom, that they wouldn't say, I want my child to be cared for. I want my child to feel a sense of safety. I want my child to feel a sense of connection, a sense of belonging, that they are affirmed for however they show up. So that is how I would message the approach of social emotional learning. It is not political. It is foundational to how we enact citizens who are prepared to take on world issues and to engage in democratic society.
Amy, may I build off of that?
Yeah.
So I had a Board of Education meeting a couple of weeks ago, and there was an article that a colleague forwarded to me just before that meeting. And it was some type of title about SEL being the next fight in education. And the subtitle was interesting. It was the trendy new education concept that will prioritize character development over actual learning. And I thought, You know what? There's so many falsehoods in just that one statement to unpack. First of all, trendy is categorically false. SEL has been around for decades, as has been established, and you can look at the work of Castle, the collaborative for SEL, and so forth. But to say that you'd prioritize SEL over actual learning, I would say that if your children don't feel belonging, as Mai said, don't feel connection, don't feel that those needs are being met, there is no real learning going on. There's no longitudinal, meaningful learning going on in a classroom if the SEL needs are not attended to. And that's been established for decades. This is not something new.
That's right. I taught history, so I could spend all day talking about Civil War, but I think you're right. If we're not taking care of those basics, it doesn't matter, how we talk about, all those dates and different generals and leaders and things, because we're missing the big picture. So I appreciate you saying that.
Amy, can I jump in just very quickly? Yeah. I just want the folks on the webinar to know of a great resource that is funded by the U.S. Department of Education. It's the Positive Behavior Interventions and Support Center, the PBIS.org center, which has some great strategies and tools for everybody involved in the education system. But I can't agree more. We talk about academic progress. But if kids don't know how to identify their emotions and to act on them appropriately, they're not going to learn, and they're not going to be good citizens, and they're not going to be good neighbors. And I think we have focused so exclusively on academics, and I'm all for focusing on academics, but not to the detriment of how are people. And I think we're such a competitive culture that everyone has to be the best. And somehow being decent is neglected when you have to be the best at whatever it is. And so I think we're seeing the outcomes of that flawed thinking right now, and the pandemic only made things worse. So there's a lot of good support out there, but we've got to recognize the absolute interconnection between social emotional health and academic progress.
Absolutely. Well, we're nearing the end of our time together, so I'd like to conclude by just asking each of our panelists to share a final thought about what it will take to change the trajectory of youth mental health and why it matters. And, just a little on that. Therese, a final thought?
Yeah, I'm going to build off of, if I may, what Kathy just said, and I think it's the priority. You look at the competitiveness of our culture, our society. I think back, I think it was 1992, the first time the New York Times rang the bell for the international test scores and the United States falling behind. And then that subsequently, unleashed a couple of decades worth of myopic focus on reading and math scores. And I think to the detriment of the other, I'll make the case, more critical facets of development that we've neglected. We conflate our measures and our goals. So public education does not establish essentially what we think is most important and then establish measures and work towards them. We're given our measures. And our measures are given from, Kathy's level and up there. So, we need to, I think, reorient our priorities and really consider other ways that we would measure our progress so the measures are appropriately aligned with what we truly want from our kids and development.
Thank you. Mr. Urban?
Before I jump in there, I do agree with Assistant Secretary Neesville. She's right, though, that because one of the things that we did this year, I just want to be clear, is that, we've been telling our staff and our entire school community that our focus this year really has to be on building relationships, social emotional learning, and health and safety. And we got to get to a new sense of normalcy. And we need to use this year as we come back, because, and I agree with you, Assistant Secretary Nees, that there's always this focus on academic. And you're right, everyone's competitive and how do we get our test scores up? But the bottom line on the other side of this pandemic, we've come back and we realize that our students have a lot of social emotional needs, not just students, but our staff, our families. And so therefore, Sure, we know we gotta educate kids at the highest level of professional excellence. We absolutely agree with that. But at the same time, we have health and safety related issues, and we have these social emotional needs. 18 months away, how do students now learn to build those social interactions, those social connections? And so that's well said, and I'm 100% in agreement. And and I'll close by saying, everyone who knows me knows that, I believe that we have a responsibility, to always make decisions in the best interest of kids, right? And we know through data and anecdotal evidence that students who struggle with mental health concerns, they cannot focus on learning. And we all know that there are both short-term and long-term consequences of this pandemic that we're going to have to reckon with going forward. So, and it's going to take a strategic, unified approach to turn things around and to truly support our youth going forward. I think, Thomas, you're right on that. I think Maya's right on that. So we need to normalize the conversations about mental health to remove the stigma associated with admitting we need help. That's it. And so we need to prioritize the public policies and the resource allocation to support the delivery of solutions for children, because we know we need more support and more personnel. And we need to strategize about the innovations and the partnerships, because we really have to find creative ways of meeting the needs of our families and our students. So, in closing, I just want to say, I want to thank everyone on the panel today, and I appreciate the opportunity to have a collegial conversation about a very important topic. And it's been an honor to join all of you today. So thank you so much, and thanks, Amy, as well, for having me.
Thank you. Thank you. Any final thoughts, Ms. Lee?
Yeah, I would just say, and I'll keep this brief, I think that what we're really talking about is what it means to be human beings. And I think somebody brought out the word, decency. Like, how do we support our children to not only develop their emotional intelligence and their social intelligence, but what does it mean to be a human being in this space? And so we talked a lot about, social and emotional and mental health, but really at the core of what we're trying to get at is to support our society to move forward, so that in the process, in the midst of all this craziness and crisis, we don't lose our soul. We don't lose our connections. We don't lose the core and the essence of what it means to be alive and to be connected in this shared experience. So I think part of what, I would just conclude and really leave you all with is, what does it mean to be successful in school? What does it mean to be successful in life? And I think that we can find the answers in the work that we're trying to embark on.
Yeah, I'm inspired. And Ms. Neese.
So I would just add, first of all, how lucky are we to have these educators in our nation's schools? I will say that as one thing. And second of all, I think that we as a society need to recognize that everybody can make a contribution and everybody can make progress. And we need to make sure that everybody, and I mean everybody, has a chance to be successful, and that we equip our schools with the resources and tools to do that. Because I know we can get out of this, and I'm buoyed by the work of these three outstanding folks, and Amy for the Kennedy Forum for bringing forth this great topic. It's not easy, but it's doable, and we know how to do it. And so thank you for giving your viewers the opportunity to see that, and that recognizing that, all of our kids have value. All of them can make a contribution to their communities, and we need to just help equip them with the tools to do that.
Well, I want to thank you all so much. Being in this field and talking about this work, there's not a day that we aren't contacted by a parent who is feeling desperate. And I know the panelists and those of you who are on are experiencing that all the time. Parents who are feeling desperate about how they find the services and the supports that they need for their children. We're contacted by educators who want to do more, want to be able to navigate this system. And I'm just so grateful for your leadership in this area. In the near future, I'm not only looking forward to reconvening with Secretary Cardona, but also with other federal stakeholders who'll be playing a key role in these advancements, including our friends at SAMHSA who have worked with DOE. And to let you know, SAMHSA has gathered an expert panel to develop a children's crisis continuum concentrated on school-based behavioral health care as a mechanism to increase access to care for children and their families. So that's coming. And for today, thank you to the Department of Education, Ms. Catherine Nees, Mr. Doc Irvin, Ms. Maicy Lee, Mr. Thomas Scarice, and our audience for participating in today's webinar. A recording will be sent to all registrants and made available on the Kennedy Forum's YouTube page shortly. Take care, everyone, and thank you so much.